So let's go ahead and take a look at the various structures that we'll see within the immune system itself. So when we break down the immune system, what we're really talking about is we're talking about a network of open capillaries and veins. They have the same anatomical structures as what we saw within the vasculature in terms of the vein and capillaries. They will, because they're open, they will siphon interstitial fluid within them and then transport the interstitial fluid from the area of collection back through the network of lymphatic veins and vessels through the cisterna chyli into the thoracic duct and then back into circulation with junction of the thoracic duct with the azygous and hemiazygous veins either going into the right or into the left subclavian and brachiocephalic veins as it heads back to the right atria. Within this network, we have a cluster of enlargements of the vessels. This enlargement of the vessels we refer to as the nodes. There are several clusters of nodes that you should be aware of. We've already talked about a few of them within the respiratory pathway. That includes the palatine and pharyngeal tonsils, but we also have other nodes such as the cervical lymph nodes, the axillary lymph nodes, the inguinal lymph nodes. But then we also have other nodes that will be found within various structures. These other nodes found within various structures can be considered as the mucus-associated lymphatic tissues. The mucus-associated lymphatic tissues we abbreviate as MALT. That includes some of the lymph node tonsils within the nasopharyngeal region, as well as within the laryngeal region. But most of these are going to be associated within the intestines. Within the intestines, this MALT tissue will cluster within some nodes that we refer to as the prior patches. There's a secondary bit of structure that is associated with the ability to seed the intestines with the normal microbiome that is associated within the intestines that can be part of the immune system, but is more part of the gastrointestinal digestive system, and that is the appendix. Some of these nodes will undergo inflammation. Some of these nodes are going to be involved with returning of fluid. And so when we look at some diseases that can take place, such as cancers, a lot of cancers will be indicated by having inflammation within distinct nodal regions, such as breast cancers being associated with nodal inflammation within the axillary nodes that are not associated with other inflammatory markers, or testicular and ovarian cancers indicated with inguinal lymph node inflammation not associated with other inflammatory or disease markers. Some of these nodes can become blocked and lead to what's referred to as lymphoma or lymphedema. People who've had mastectomies are more prone to axillary lymphedemic issues. That is, well, they'll have swelling within the upper extremity because of the removal of the axillary lymph nodes within that circulation. People can have blockage of the inguinal lymph nodes leading to a condition known as elephantitis. A lot of times that elephantitis will be associated with some sort of parasitic infection within the lymph nodes themselves. So as I stated earlier, some of the MALT will be associated with the tissues of the intestines and lead to the development of what's referred to as the prior patches. The prior patches are basically lymph nodes associated within the mucosa and submucosa of the intestines that allow for active engagement with any pathogenic materials that might have been digested and absorbed before that material can go about going into circulation so as to once again develop a secondary layer of defense within the alimentary canal. Within the vessels themselves, we have enlargements. These enlargements are referred to as lymph nodes. The lymph nodes are a combination of various types of tissues and structures. The principal connective tissues that we will see within this will be loose areolar and reticular connective tissue. The reticular connective tissue develops into the trabecular and reticular sinuses based off of where we see them. The reticular sinuses and medullary sinuses are going to be found closer to the hilum of the lymph node, whereas the trabecular and cortical sinuses are going to be found closer to the afferent lymph vessels coming into the lymph node itself. Within the lymph node itself, we can look at what's going on in terms of where we'll see distinct cells within the areas of the lymph node, where within the cortical areas, we will indicate seeing things like B cells, dendritic cells, and macrophages. These areas within the cortical areas will be found within what's referred to as the germal center. The germal centers and trabecular centers in the cortex is where we're going to have our active macrophagic activity taking place. As we move towards the medular part, we start getting into what's referred to as the inner cortex. As we get to the inner cortex, we're going to start seeing our T cells and our dendritic cells, where we're going to start having our cytotoxic responses taking place, as well as some more macrophagic activity. As we head into the medullary region of the lymph node, we're going to start seeing the plasmal B cells. Those are the activated B cells that are producing antibodies. These antibodies and the macrophages that are found within the medullary part of the lymph node will be involved with secondary activation sequences taking place, leading to inflammation within the lymph node. In a second here, I'm going to talk about flow through the lymph vessel, flow through the lymph node itself as it relates to flow within the lymph vessels. As the pathogen is being actively defensed against, what ends up happening is that we'll start seeing a slowdown of lymphatic flow through the nodes, and that's going to lead to inflammation within the nodes. Most of the inflammation within the nodes is controlled and regulated by activation of the T cells, the macrophages, and the dendritic cells, triggering all of the inflammatory markers that we see. Now, one of the things that you'll notice within most of the slides of the lymph nodes is distinct coloration differences, and the distinct coloration differences is the indication of where we see the reticular proteins and the ability for fluid flow to head through the various regions of the node themselves. So we're looking here at a tonsil as opposed to one of the standard lymph nodes, where we see the germal centers with reticular proteins creating canals. Those canals that the reticular proteins form is what allows for fluid flow to head through. In order to get into the medulla region of the lymph node, the pathogenic antigen and fluid will pass through slit membranes within the sinuses, leading into the medulla. What this does is allows for us to track the flow through the lymph node. And so when we talk about tracking the flow through the lymph node, what we're talking about is we're talking about the afferent lymph vessels. These are the venules of the lymph coming down and making connection points with the nodes themselves. Now notice there are valves on the lymph vessels, just like we saw with valves on the veins, the venules of the cardiovascular system. This functions the same way, which means that we're trying to continue to have fluid flowing in one direction. These afferent vessels will branch apart into a divergent collateral pathway. These divergent collateral pathways will enter into the cortical region within the cortical sinuses. The cortical sinuses will head through the trabecula into the trabecular sinuses. The trabecular sinuses will head into the medulla within the medular sinuses. The medular sinuses will coalesce around the medulla and develop into what's referred to as the nodule helium. The nodule helium is going to have the coalescence of the cortical sinus with trabecular sinus with medullary sinus, in which the fluid flow that had been passing through the various tissue layers within the node will truncate into distinct vessels. These distinct vessels we reference as the efferent lymph vessels. These efferent lymph vessels will continue along and then coalesce into the lymphatic veins that will continue on forming the larger network that we saw earlier. The fluid that we see within the system itself is referenced as lymph. Lymph, in terms of chemical composition, is very similar to what we saw with plasma. There are some proteins that we see in plasma that we do not see in lymph. Some of them are related to some of the chemical compositions that we see within distinct characteristics of plasma as it relates to the function of plasma. The nodes themselves are the active site for infection responses within the lymphatic vessels themselves. These lymphatic nodes will become inflamed during periods of active immune response, and that inflammation within that can lead to swelling and all of the other cardinal signs and symptoms of inflammation: tenderness, soreness, a little bit of fever within that area. So that's part of the system in terms of the gross anatomy. The other part of the system that's associated with the gross anatomy that we'll look at here is the spleen. The one part we're not going to look at is the thymus, as the thymus is strictly in the development of the T cells. So when we talk about the anatomy of the spleen, we're basically looking at a collection of lymphatic tissue that surrounds fenestrated capillaries that allow for the development of what's referred to as a red pulp and a white pulp area. The red pulp is the collection of blood as it passes through the spleen. The white pulp is the active area of immune tissue. In this, we have two distinct regions: the stroma, or the capsule made up of the trabecular and reticular fibers, and then parenchyma, which is the pulp matter that we see, in which we have the white pulp, which is the lymphatic tissues, which include the lymphocytes and the macrophages that are going to go about taking care of immune processes. And then the red pulp is going to be within the venal sinuses that you see within the diagram. This is the area where the macrophages are going to be removing any RBCs that have membrane deficiencies, membrane defectiveness, or have been quote unquote worn out due to the exposure to ROSs and or other metabolites. It can store up to about 1/3 of the platelets for the body, which can become problematic if we happen to have damage to the spleen. It is also the primary site for development of erythrocytes and granulocytes during fetal development, particularly during the fetal development stage where bone is in the process of being formed. One of the things that we can look at when we look at in terms of the histology of the spleen is we'll notice that there are distinct channels within the spleen that are truncated by reticular proteins. This truncation of the spleen in terms of the channels that we see as it relates to flow through the spleen directs flow towards the pulp matter away from the central artery, where surrounding the central artery will have that white pulp matter, whereas towards the venal outflows we'll start having the red pulp matter within the spleen itself. So this takes care of the gross anatomy of everything with the exception of the thymus, which we'll touch on when we talk about the development of the thymus-derived or T lymphocytes.